the mouth. Nothing tells more about us than this one feature. We laugh with it, we talk with it, we kiss with it. And we eat with it. Our teeth are important, but they're not indestructible. Without care, they can become diseased and painful. And the biggest cause of tooth pain is sugar-loving bacteria. Bacteria are always present in our mouths. As they break down food, they produce acid. And acid is a tooth's worst enemy. Acid attacks the tough outer enamel of the tooth, roughening the surface. Eventually, a hole erodes and a cavity has begun. At first, a cavity is often painless. We don't always notice it until the decay spreads deeper. But once it reaches the live nerve center, the pulp, the toothache can be agony. Ultimately, the tooth may even die, and all due to bacterial acid. Besides acid, certain bacteria also produce a sticky film called plaque that clings to tooth surfaces. Normally invisible to the naked eye, this plaque holds the bacteria and their acids tightly against the teeth in a slimy plaque meshwork. Gradually, more plaque collects around and between the teeth, in the back corners of the mouth, and just under the gum line. If plaque is allowed to accumulate, especially in pockets of the gum under the surface, it can lead to real problems, like periodontal disease. Periodontal disease is serious, more serious than cavities, especially for people in their teens and older. It attacks the gum tissue surrounding the teeth and can even destroy the bone that supports the teeth. Now for the good news. Plaque is a problem we can do something about, but we've got to do it right. When you look at all these people brushing, you may not realize it, but only a few of them are brushing correctly. The others are just rushing through it as if this was a race called the 32-tooth dash. That's simply not good enough. Plaque is tough. If we're going to get rid of as much of it as possible, we've got to work at it the right way. Let's find out how an expert does it.
First of all, we want to know where the plaque bacteria is hiding. This is what causes the disease. So we're going to be chewing a disclosing tablet to find out where the plaque hides. And a disclosing tablet looks like this. It's a very small red tablet. What we're going to do is put it in our mouth, crunch it up, swish it around, and have a peek in the mirror. And then we'll be able to see where it's hiding. In this case, it's pretty obvious. The red areas between those two upper teeth. Now let's do something about it. Have you looked at your toothbrush lately? It may look like this. It's flared, it's very hard, and it doesn't look too nice. It's time to get a new toothbrush. So we want to use this proper brush here, and it has very soft bristles, nylon tips, and a rounded edge so it won't damage your gums. So we can get at the places where the plaque hides the most, as we saw by the disclosing tablets. All the red areas were at the gums and between the teeth, so we have to do a proper brushing job. And to do that, we have to do it in an organized fashion, going all the way to the back, coming around, and massaging the gums and using a sweeping action. I can show you on this giant model here, so we can see very clearly. And remember, the plaque's invisible, so we have to brush all the areas so we don't get any periodontal disease or tooth decay. So I'm going to start way at the back, and you can see here that I'm just going to massage by placing the brush at an angle facing up and going round and back and forth just to circulate the blood flow so we have healthy tissue. And then using my wrist, sweep away all the debris and plaque that I've loosened up there, and just move along in a nice fashion, overplacing my placements rather than jumping way over there. Then we've missed all the teeth. So this is what we're doing. Of course, when we finish the top, we do the bottom, and it's the same action. Really brush well at the back. So many people miss back there, and it's a very important area. When you do the inside, we're going to do the same thing, but when you get to the front teeth, we're going to put the brush in a vertical position, massage the gums, and brush out because it cleans much better there. Finally, brush your tongue, then rinse, and you're through. Even when we do our best job brushing, there's still plaque hiding in between our teeth. And if we use those disclosing tablets again, we'd see the red marks there. So we want to get rid of them. And the only way to do it is to use the dental floss. So So we're going to take an arm's length of dental floss, which you can buy at the drugstore, and wrap it around our middle fingers. And when we have it wrapped around our middle fingers, not too tight because you don't want the fingers to turn blue, you're going to slide it in between your teeth very gently till it reaches the gums. And when you look at your gums, you'll notice that it's in a V shape. And you want to go on one side of the V until there's a little bit of resistance. It should never hurt. Make a C shape around the tooth and just slide it up and down till it's squeaky clean, and then hug the floss down. You have to do it on the other side of the V of the gum as well, because there are two surfaces between each tooth. And when the floss becomes frayed or soiled, we'll rotate to a new section of floss and keep on going. So we're going to do that to all the teeth in a nice order, even till you get to the back. The back tooth still has to be flossed, even though there's no opposing tooth. And that has to be once a day. Now, it's going to take a lot of practice. You're not going to feel too comfortable at first doing it. But after some practice, you can do it in front of the TV while the commercials are on before you go to bed.
Brushing and flossing are well worth the trouble, but they're not the easiest skills in the world to learn. If you have any questions, don't hesitate to ask. You should see your dentist or hygienist every 6 months to clean away hidden plaque you just can't reach, and to polish your teeth so that bacteria and plaque have fewer places to stick to. Your dentist may have other suggestions as well, like fluoride treatments, and maybe hints for a plaque-fighting diet.
That's good. And just close like
Your teeth are important, and with proper brushing, flossing, and regular dental checkups, you will help keep them strong and attractive. Look after your teeth, and they'll last a long, healthy lifetime.